and I'm a professor at Tufts University and Tufts Medical Center, and I'm pleased to moderate today's webinar, which is the next in a series brought to you by the Institute for the Advancement of Food and Nutrition Science, or IFANS. This one's focused on clarifying the science around low-calorie and no-calorie sweeteners. I just wanted all of you who are dietitians to know that this webinar is approved for one continuing education credit through the Commission on Dietetic Registration. So after the webinar, all you need to do is you'll get a brief survey which will allow you to access the certificate. So answer it and you'll get the certificate. Just for those of you who aren't familiar with IFANS, it's a nonprofit scientific organization that advances food safety and nutrition science for the benefit of the public health. And intellectual contributions from industry, government, and academic scientists are all involved to identify areas of common interest. I like this graphic a lot because it really lays out easily what's going on here. Currently, I'm serving as an advisor to the IFANS Scientific Committee on Low-Calorie and No-Calorie Sweeteners. And this is the committee that's organized this webinar series. And you can see the mission of the group on this slide here, which includes an effort to communicate science to the healthcare practitioner community. And that's why we're here today. On this slide, what you see is some of the details of the control panel. And just note that the question box is there. We encourage you to type your questions here. And the questions are only visible to the staff, not to everybody, all of the attendees. So after both presentations, submitted questions will be read to the presenters to allow for a dialogue. So we'll get through as many questions as we possibly can. And if it's to a specific person, be sure to put that on your question. Next slide. Okay. Well, here you can see our program for today. And you see, I think it's going to be exciting. The objective is to, first of all, better understand the evidence that's been collected and reviewed to lead to recommendations about the use of low-calorie and no-calorie sweeteners to achieve various diet and health goals. And uniquely, we're going to have a nice comparison of approaches between the US and Canada to understand that the different regional approaches and how these lead to recommendations. And so let's get right into it. And I'll introduce first Dr. Meyer-Davis. Dr. Davis is the Carrie Boshimer Distinguished Professor of Nutrition and Medicine and the chair of the Department of Nutrition at the University of Chapel Hill in North Carolina in Chapel Hill. And she's focused much of her career on diabetes, including the epidemiology and natural history of the disease, both type 1 and type 2, and in both children and adults. And Dr. Meyer-Davis is very active in the American Diabetes Association. In fact, she was the 2011 president for healthcare and education for ADA. And she's also served most recently on the 2020 Dietary Guidelines Advisory Committee, as well as serving prior to that as an appointee of President Obama on the advisory committee group for prevention, health promotion, and integrative and public health. So Beth, welcome to you, and we look forward to hearing your insights on the Dietary Guidelines Advisory Committee process and your perspectives and how they relate to low and no-calorie sweeteners.
All right, thank you, Johanna. And I'm assuming that I can be heard And my screen is showing all right? True?
Yep, perfect.
All right, excellent. So I'm going to go over, from the U.S. Dietary Guidelines Advisory Committee perspective, a review of the methods that we use, the evidence, conclusions, and implications with regard to low and no-calorie sweetened beverages. And you'll note beverages here, and as I go through this background, you'll hopefully see why my presentation is limited to beverages. All right, so I am going to spend a little bit of time on background here to understand the process and the context. So the first step to update the U.S. Dietary Guidelines is actually a review of science that's conducted by a federal advisory committee, which is the USDA, HHS, that convenes a Dietary Guidelines Advisory Committee. And that committee conducts an independent review of the current science with regard to specific questions that I'll describe a bit. And there are multiple opportunities throughout that process for public comment, and those public comments are reviewed and taken quite seriously as we go through the process. And ultimately, then, the committee submits their report of its findings to the secretaries of USDA and HHS. And the scientific report is posted for public comment and also federal agency review and further comment, and then it is ultimately finalized and is available if anyone would like to see it in full at dietaryguidelines.gov. So then USDA and HHS actually write the dietary guidelines for Americans, and each edition of this builds on the previous edition with scientific justification for any changes that are informed by the committee's scientific report, along with additional input from federal agencies and the public and so forth. And again, quite a lot of opportunity for public input there. So the 2020-2025 Dietary Guidelines is available also at dietaryguidelines.gov. So further on the process, so what is the scope of work for the Dietary Guidelines Advisory Committee? We were provided about 80 questions up front, and those 80 questions defined the scope of the scientific review that we would conduct, we being the Dietary Guidelines Advisory Committee. And those questions were established prior to convening the committee through an iterative process with USDA and HHS drafting key questions and obtaining public input as to those questions. And those are questions that would have the greatest relevance and import with regard to updating the dietary guidelines. So to address those questions, the Dietary Guidelines Advisory Committee was organized with subcommittees, and those are listed here. And just so you all know, I served on the Dietary Patterns Committee, and I also served to chair the Beverages and Added Sugars Committees, which is presumably why you happen to be listening to me today and not any one of the other members of the committee. So one of those 80 questions was the following: what is the relationship between beverage consumption and growth, size, body composition, and risk for overweight and obesity? And it won't surprise anyone that quite a few of the questions posed to the committee related to growth, size, body composition, risk for overweight and obesity. And that's for obvious reasons, which is the ongoing epidemic now, unfortunately, pandemic, I think, of overweight and obesity, certainly in the United States. And that has obvious, tremendous public health implications. So there was a lot of focus on aspects of nutrition that would relate to this topic. And so low and no calorie sweetened beverages was one of the beverage types that we considered as part of the work of the Beverages and Added Sugars Subcommittee. So the approaches that were taken to examine evidence for any of the questions included data analysis, food pattern modeling, and a systematic review. And by data analysis, that refers to national data sets that would allow us to understand current health of Americans and dietary intake of Americans. And that helped provide a lot of practical context in terms of thinking about what was relevant, what was achievable, what might be realistic. And then the food pattern modeling was done to help understand how changes in the amounts or types of foods or beverages in a dietary pattern might impact on either meeting nutrient needs across the US population, and then you could consider how that might affect health. The systematic review, that was considered as the scientific review of the literature, and was conducted really as a research project to answer specific questions on diet and health. This is something that I'm going to spend just another couple minutes describing how that was done, because that really was the primary approach for this question around low and no calorie sweetened beverages. So I will say first that it was the committee that made all the decisions required to develop protocols for each of these three approaches of examining the evidence, and that guided the work that was done. Now, the USDA and HHS staff supported implementation of those approaches and the protocols that were determined by the committee, and there is no way that we could have done this work just humanly, physically, without the incredible support of the USDA and HHS staff. But the conclusions that were reached were all the conclusions determined by the committee. All of the draft and final protocols and all the draft conclusion statements were posted at dietaryguidelines.gov throughout the committee's review, and were available if anyone from the public wanted to comment on the protocols as well as the draft conclusions statements themselves. And in addition to opportunities to post comments, public comment was also obtained at selected meetings that were held that people could register for and have time to present their comments. Okay, so NESR, I think that acronym was on a previous slide. I should have defined it then, but that stands for Nutrition Evidence Systematic Review. And it was NESR that supported the review of the literature. And you can see on this slide at the bottom a link if you want to take a look to find out more about NESR, nesr.usda.gov. So again, the 2020 Advisory Committee, Dietary Guidelines Advisory Committee, did establish all aspects of the protocol for the review to be done, and then reviewed the studies that met inclusion criteria, deliberated on those studies, discussed and debated, and wrote the conclusion statements that were included in the final scientific report that, as I mentioned, was ultimately submitted to USDA and HHS as input for the dietary guidelines themselves. So the NESR staff facilitated, they executed the search and documented work per methodology that included a risk of bias assessment. And that's very important in conducting these kinds of literature reviews, to systematically consider various aspects of potential risk. And various biases are listed here. And so each of the protocol included review of each of these potential biases along the way. And then once all this work was done, a final step was peer review that was conducted by federal scientists, and that was completed after discussion by the committee at a public meeting. So it was a very much an iterative process with a tremendous amount of rigor. So this is an example of an analytic framework for the scientific review, and this was for beverages, growth, size, and body composition. And again, the question here, systematic review question, what's the relationship between beverage consumption and growth, size, body composition, and risk of overweight and obesity? And among the interventions or exposures, you see highlighted in yellow, low or no calorie sweetened beverages. So that's the context that we're talking about. And then there were comparators there that you can see, including different amounts of the same beverage, the particular beverage versus a solid versus water, and a couple of other specific potential comparators. And then the outcomes were specified, and you can see those in that box on the right. And then we also specified key confounders that we were looking for the studies to have accounted for. And so each study that was reviewed, there was a check to see if any or all of these confounders were considered in the study. And then other factors that needed to be considered, such as total energy intake, timing of consumption, et cetera. And you can see the list there as well. One other thing to note on this protocol, there was a specific definition of the low and no calorie sweetened beverages, and you can see that at the bottom here: diet soft drinks, diet sports and energy drinks, or other diet drinks that are low and no calorie sweetened with 40 calories or less relative to the reference amount of what was customarily consumed. So all of those definitions had to be, that definition had to be met for inclusion. So this is the flow chart of the number of papers considered. So for this question, after removing duplicates, there were over 17,000 papers initially identified. And then you can see the sort of fallout having screened out based on title, abstract, and then full text. And ultimately, we identified 37 papers focused on low and no calorie sweetened beverages, and 8 papers that focus specifically on a contrast between low and no calorie sweetened beverages and sugar sweetened beverages. So these are the papers that I'll focus on that provided the basis of the review. But, you know, just to note, we did start out with 17,000 papers, right? And we ended up with a meager 37 straight on, you know, low and no calorie sweetened beverages, plus another 8 comparing with sugar sweetened beverages. So it's just often the case that when you really have a rigorous review, the amount of literature that you're able to include systematically and rigorously is oftentimes, and it was true here, certainly smaller than one would like. Okay, so of those 37 articles on low and no calorie sweetened beverages that we reviewed, 17 were in children, and that was ages 2 to 16 years in those papers. All of those studies were prospective cohort studies, and they varied in duration of follow-up from 6 months to up to 12 years of duration. And the analytic sample sizes ranged from 49 to over 11,000. There were 20 articles in adults, 14 from prospective cohort studies. There were 6 from RCTs, and analytic samples ranged from 50 to over 51,000. So what did we find in those papers? First, we'll focus on children. So the majority of those papers, about 75%, found no association for the main outcome measure of adiposity, whatever that happened to have been, in the study population. Now, for the remaining studies, there were mixed associations. 3 articles actually had findings of increased adiposity measures with intake of low and no calorie sweetened beverages. 1 had decreased adiposity measures, and 1 reported only height-related outcomes. Now, these studies had a number of limitations. There was, across the board, inadequate adjustment for potential confounders. There were inconsistency in methods to assess intake of these beverages. Many of the studies had short study duration relative to our outcomes of interest and fairly high attrition. So, you know, there really were substantial limitations in these papers. So based on that, the conclusion statement for children was that limited evidence suggests no association between low and no calorie sweetened beverage consumption and adiposity in children with a grade of limited. Now, I didn't take the time in this session here to go over the definitions of the various grades. Limited means what you think it means, you know, that there's really not very much evidence, and the information about those specific definitions can be found by looking at the through the protocols, again, via the Dietary Guidelines.gov website, where an enormous amount of detail is available. But the limited evidence pretty much means what it says. Okay, so let's turn to adults. So the majority of those studies in adults, about 72%, have reported a significant effect or association between low and no calorie sweetened beverages intake and adiposity, although the findings were not always consistent within studies when multiple outcomes were reported. So there was an RCT and a large prospective cohort study that found associations between low and no calorie sweetened beverages and reduced adiposity. But across all of these studies, again, there were significant limitations, particularly in the experimental studies with limited sample size, limited study duration, no assessment of compliance, which is an obvious problem, and differences across studies in the comparators that were used. For the cohort studies, there were also some substantial limitations, including small sample size, pretty high attrition, and poor generalizability. So with that in mind, the conclusion statement for adults was that limited evidence suggests that low and no-calorie sweetened beverage consumption is associated with reduced adiposity in adults. So a little bit different conclusion than with children, but again, the grade for that statement was limited. The evidence grade was limited. So you'll recall that there were 8 studies. I just reviewed 37, 17 plus 20. And then there were 8 articles in which low and no-calorie sweetened beverages were compared to sugar-sweetened beverages. 2 from children, both from the same randomized controlled trial. And then there were 6 articles with adult populations, 5 RCTs, and 1 prospective cohort study. So for children, the evidence from those papers was too limited to draw a conclusion about a relationship between the low and no-calorie sweetened beverage consumption compared to sugar-sweetened beverage consumption and measures of adiposity. And adults, the evidence was relatively consistent, showing no association between sugar-sweetened beverages compared to low and no-calorie sweetened beverages on the adiposity outcomes. But again, the studies had small sample sizes and a variety of real limitations in those studies. So the conclusions then regarding this comparison between the low and no-calorie sweetened beverages and sugar-sweetened beverages was for children, insufficient evidence was available to determine the relationship between those different beverage types, and the grade was not assignable. That was for children. For adults, there was limited evidence showing no association between those 2 different beverage types. Okay, so what are the implications here? So let me back up real far and give the context, which is that unfortunately, the vast majority of people in the United States are not consuming a dietary pattern according to the dietary guidelines. And in fact, many of you, I'm sure, are familiar with the Healthy Eating Index. And a higher Healthy Eating Index, just as a reminder, is associated with lower risk for cardiovascular disease, diabetes, some cancers, and for better health for those who do have diet-related diseases. And out of 100 possible points, the average HEI score in the United States, and you can see the reference below, was 59. So in that context, and now this is my opinion, this slide, is to note that there is a tagline in the US Dietary Guidelines for Americans, the most recent edition, which is to make every bite count. And that's related to this HEI score most recently for the country of about 59. So with that context, given only weak available evidence, it appears that for children and adults, low and no-calorie sugar-sweetened beverages do not have a major impact on adiposity. And to emphasize practical food and beverage choices that make a positive contribution to meet nutritional requirements and overall health, including healthy weight, is really the way to go. So there are many things that one could focus on, but making every bite count towards that goal of nutritional requirements and overall health is really the best that we can say, I think, from this particular evidence. So thank you so much for listening to the presentation, and I'll look forward to answering questions a little bit later on in the webinar. Thanks so much.
Thank you, Beth. It was just terrific. I really learned a lot from that. And we'll take questions at the end. There'll be lots, I'm sure. But what I'm going to do now is turn north to Dr. LeBay, who's up in Canada. And Dr. Mary LeBay is professor and former chair at the Department of Nutritional Sciences, Faculty of Medicine at the University of Toronto in Ontario, where she leads a research group on food and nutrition policy for population health. And Mary is an expert on public health nutrition policy and food nutrition regulations. For example, in 2018, she was named a member of the Order of Canada, which is a very distinguished award in Canada for her contributions to the health of Canadians and as a champion of nutrition. And what she's done also, of course, affects us down south of their border. Dr. LeBay is a member of several committees of the World Health Organization, including the Nutrition Guidance Expert Advisory Board on Diet and Health. And before she joined the University of Toronto, for many years, she was director of the Bureau of Nutritional Sciences at Health Canada in Ottawa. So we'll turn the platform over to you, Mary, now to share the Canadian approach to developing guidance for use of low and no-calorie sweeteners in the diet. Mary, take it away.
Okay, thank you very much, Joanna. And can I get confirmation that you can see my slides okay?
All looks good.
Okay, thank you very much. Well, thank you very much. I'd like to express my appreciation to iFans for giving me the opportunity to speak to you today about the, I guess, a little bit of a different perspective on how Canada's Food Guide deals with low and no calorie sweeteners. And so you'll get a bit of a contrast, but a lot of similarities on the approach towards the recommendations around the consumption of low and no calorie sweeteners in Canadian Dietary Guidance, which is our Canadian Food Guide. So let me just switch slides here. Oops, webcam is closed. Okay. Yeah, so excuse me. So what I'm going to speak to you about, just a couple of things. First off, I'm just going to give you a little bit of context about sweeteners. In Canada, they're considered a food additive. Next, I'll address our 2019, which is our most recent Canada's Food Guide, and the components, which is somewhat different from what you have in the US. And then I'll go through, just like our previous speaker did, the evidence review process and the supporting documents around the Canada's Food Guide recommendations. And then I will overview the Canada's Food Guide recommendations on both beverages and then on the use of sweeteners and sugar substitutes. And then finally, I've just got one slide that I've included if I have time that gives you a bit of data about from our own lab actually, and it wasn't part of the dietary guidance, but to give you an idea of the use of these sweeteners in the Canadian food supply. Let me switch slides here. Okay, so as I said, sweeteners, or the low and no calorie sweeteners, they're actually authorized as food additives in Canada, and their use is authorized to impart a sweet taste in food. So they're very specifically approved in Canada as a food additive. And the way this is done, they're incorporated by reference. In other words, they're named in a document entitled The Marketing for Food Additives that may be used as sweeteners. And I've given the reference link down below to the Health Canada document. In that document, it lists more than 20 food additives. And I think the last time I checked, there are probably 22 or 23. And these food additives have all been assessed for safety. And in that table, it lists the various food additives that can be used in Canadian foods. It not only lists the food additives, it lists their permitted uses, in other words, which foods they can be added to, because it's not necessarily every food can have a sweetener added to them. And then additionally, the levels that they're permitted to be added. So it's a positive listing. In other words, only these food additives can be added to foods and only at the levels that they're permitted in that document. And I think it's important to point out that when these food additives are approved for use, the food additive approval process focuses specifically on safety rather than looking at health benefits, which I would say is more the role that the Food Guide Committee was examining. Okay, so this slide just presents an overview of some of the products from Canada's Food Guide, and as I mentioned, it was most recently updated in 2019. And there's actually quite a few differences in the new food guide, and you can see the link, and this is only some of the documents. There's a large number of other documents and consumer-friendly and technical documents available on the Health Canada website. But the food guide, and this first 2 pages are the what I would call the public-facing part of the food guide, which is the healthy food plate, which has half of the foods from fruit and vegetables, protein-based foods, and you can see a variety of protein-based foods, and then a recommendation to choose whole grain foods. But I think importantly to this presentation is the recommendation around eating protein-based foods, and it says make water your drink of choice. So that's really relevant to the talk today. Is of beverages, water is the preferred beverage. And although I won't spend a lot of time today or much time today, the food guide also on the flip side, or the second half of the food guide, is really about healthy eating patterns and healthy eating habits that support healthy eating. In other words, be mindful of what you eat, encouraging cooking more often rather than eating out, recognizing food as part of enjoyment. It also to recognize the importance of eating meals with possible with others, using food labels, and be aware of food marketing and limit intakes of foods that are high in sugar, sodium, and saturated fats. So those are the public-facing documents. And the second part of the food guide is called Canada's Dietary Guidelines. And this is really much more the technical report, and much of what I'll be speaking to you today comes from this technical Canada's Dietary Guidelines report, which is really set up for health professionals and policymakers, but it really provides the details around these recommendations and a lot of information on how to explain them, how to use them, and how to make dietary habits sustainable and useful for Canadian consumers. And now the second part of the Canadian Dietary Guidelines process was really the evidence review supporting the new food guide. And I'll make a couple of very important comments, because I think this is really important when you think about how evidence evolves and what type of evidence gets into the food guide and developing the food guide. First off, the evidence that was used in developing the 2019 Canada's Food Guide was based on a 2015 review of the evidence, and then it was supplemented with an update that was done in 2018 to capture the new and evolving evidence that occurred between the first review done in 2015 and then up to 2018, which then obviously that was the most current set of evidence that then was inputted into the 2019 food guide. And it's important to remember that the evidence was used had to be considered convincing, although you've heard some words like possible associations, may be associated, and the decision of the food guide, if we're going to make such an important public policy document in Canada, the evidence that supports the recommendations in the food guide should be based on the level of convincing evidence. And so now the components of these evidence reviews, we're looking at the scientific basis of developing food guidance. In other words, examine the DRIs for requirements and excesses, and also importantly, the evidence around the relationships between food and health. And there is a technical report that's over 100 and some pages, or several hundred pages, and with many, many links to all the relationships that were examined between food and health. And the types of sources that were used were reviews from federal agencies and authoritative bodies, so not just Canadian sources, but globally, as well as systematic reviews. And then a lot in the next part was also Canadian context, which is very similar to the process described in the Dietary Guidelines for America process, where Canadian national survey data that examined the population, Canadian population, for example, the dietary intakes of Canadians, the health measures of Canadians, as well as dietary patterns of Canadians, and other scientific reviews such as health claims assessments that had been done in Canada. And then finally, there was evidence around the use of our previous food guide by consumers and intermediaries, and there was quite a bit of evidence and focus testing to see whether there were improvements that can be made in the newest iteration of the food guide. So with this evidence, and I didn't go through and examine all the dietary questions the way Dr. Beth Myers did before, but very similar type process. And as a matter of fact, the NESI reviews were also part of the evidence that was included in the evidence reviews for the Canadian Food Guide. And so my next couple of slides, I'm actually going to go through what the Canadian Food Guide actually says around both beverages and then the issues around non-nutritive sweeteners or sweeteners. So as I showed you earlier in the presentation, the recommendation around beverage is to make water your drink of choice. And that should be your beverage, and that should be the first beverage recommended, although there are obviously beverages recommended in the protein group. And in Canada's Food Guide, there are recommendations that other healthy beverages that are promoted by the Food Guide include lower fat plain milks, that's plain milks, fortified unsweetened plant-based beverages, and unsweetened coffee and teas. But you can see that when all else, water should be the beverage of choice. Now that's on beverages. Now specifically, there is more information in the second set of guidelines, section 2 on, and this is a section on foods and beverages that undermine healthy eating. And this is a section where a lot of evidence was reviewed about the role of processed and prepared foods and beverages and how they contribute to excess sodium, free sugars, and saturated fats, and how they can undermine a healthy eating pattern, and that these types of foods should not be consumed regularly. So a number of evidence reports looked at a number of considerations, and one of them was around the issue of sugary drinks and confectionaries and sugar substitutes. And in the Canadian Food Guide, there is an explicit recommendation that sugary drinks and confectionaries should not be consumed regularly. But if they're not being consumed regularly, obviously the water is the beverage of choice, and there's an explicit statement that sugar substitutes do not need to be consumed to reduce the intake of free sugars. And as I indicated earlier, there are a number of other healthier beverages that can be used as replacements for sugary drinks. And I think in this section, I think it's very important, and this is where the importance of the grading of evidence is important in setting national food guidance and dietary guidelines. There's a very clear statement in the Canada's Food Guide Dietary Guidelines report that said, as there is no well-established health benefits associated with the intake of sweeteners, nutritious foods and beverages that are unsweetened should be promoted instead. So in other words, this is the recommendation that we should be promoting unsweetened versions of foods and beverages. In other words, to change the food habits and the taste acuities of Canadians to be the preferred ones to be the lower sweetened products, as opposed to using sweeteners that continue to enhance and reinforce that notion of sweetened foods. All right, and so this is the evidence, and this is the recommendations that now appear in the Canada's Food Guide. And I just have another slide or two where I wanted to just give you some idea from some work that came out of our lab about the use of sweeteners in the food supply, because I think that's where people want to know, where they are already there and how prevalent they are. And so in Canada, we've developed a program, and we call it the Food Label Information Program, or shortened as FLIP. And it's very much similar to the USDA's branded food database. And it was started in 2010 at the University of Toronto. And it is a database of the branded food products that are sold on the Canadian marketplace. And we collected these foods in collaboration with the grocery retailers in Canada, who allowed us to enter their stores to collect all the foods on the Canadian grocery store shelves that have nutrition labels. So this is a database of packaged foods. So it doesn't include unprocessed, unpackaged foods, but it does include all the packaged foods, and the criteria to collect the foods were those foods that had a nutrition facts table. But importantly, with using this database, we also have collected all the information on the ingredient list for each of these products that are sold on the Canadian marketplace. And the database in Flip contains about 65 to 80% of the foods that are available on the marketplace in Canada of packaged foods. And so one of my recent students who just recently graduated, Madison Whippert, actually was doing her thesis on free sugars. But as of course, she's obviously examining the free sugar composition of Canadian foods. In examining the ingredient list, she also looked at the presence of sweeteners in Canadian foods. And I just took this slide from her thesis and just wanted to point out of which food categories, and these are the major food categories that contain these sweeteners, added sweeteners. And you can see from this slide, the major food categories, 2 of them particularly, are beverages, and that's not surprising. They contain, about 10% of them contain a sweetener, and another 9 to 10% contain both a sweetener and free sugar. So about 18% of beverages have at least a sweetener added to those products, and about 14% similarly of other foods. And these others comprise foods like baking ingredients, sweeteners, but also foods such as, let me think, I've got it written down here, I'm sorry. Many of the foods that have been added, for example, frostings, seasonings, many of the components that are added to food. So a lot of the condiments, seasonings, sweeteners, things like that are in that food category, with about 14% of those products also containing sweeteners. And then a fair amount added to fruits, but of course these are packaged fruits, so you have things like canned fruits, and quite a few added, no surprise, to desserts and sugars and sweets and bakery products. But these products still, by far away, are mainly comprised of free sugar ingredients rather than added sweeteners. So I'm going to be winding it up fairly shortly, and I'm just going to summarize some of the results that what I've said, that what we're seeing in Canada. So just to remind you that in Canada, sweeteners have been approved by Health Canada as food additives, and they're approved for a specific food additive use, and that is to impart a sweet taste to food. And that approval process is based on a safety assessment rather than dated on providing a health benefits. While on the other side of the coin, Canada's Food Guide was looking for positive health benefits in making its recommendations in the food guide. And in this case, the strongest evidence was to promote water as the beverage of choice and as a substitute for sugary drinks. There was not positive associations on a positive benefit of these sweetened drinks with low and no calorie beverages on promoting health. And as well, recognizing that other healthy beverages that are also promoted in the food guide include the lower fat plain milk beverages, fortified and unsweetened plant-based beverages, and unsweetened coffees and teas. And I think that the other couple of important points in Canada's food guide is that there are many opportunities, and so that sugar substitutes do not need to be consumed in order to reduce the intake of free sugars. There are many alternatives to consuming free sugars, and in actual fact, because there are no well-established health benefits associated with the intake of sweeteners, it is recommended that nutritious foods and beverages that are unsweetened should be promoted instead. And this has the added benefit of not promoting continuous intake and searching for sweetened foods. And many of the foods that are sweetened are not foods that we typically consider as sweet foods, such as your confectionaries and desserts, but many other food categories are already sweetened with free sugars in them. And just to remind you that the food categories right now with the highest use of sweeteners are beverages and the other food category that I mentioned, but a fair amount already found in fruits and sugars and sweets and the dessert food categories, which the sugars and sweets and the dessert food categories are the food categories that provide the highest amounts, as well as the beverages that provide the highest amounts of free sugars in the Canadian diets. And with that, I'd like to thank you for your attention. And I think my time is just about up. And just to recognize that the work that we've done in our lab is really part of a large research team. And of course, recognizing the work of the folks at Health Canada and the folks that have been involved in developing Canada's food guide that were involved with the work that I presented here today. So thank you very much for your attention.